Welcome. Today's Monday, October 6th, 2025. It's 5:30 p.m. First on the agenda tonight, item A is Brian McCain, Chief of Staff, 5-minute presentation.
Thank you, sir. Mayor Graham, CSU Pueblo Town Hall is tomorrow, Tuesday, October 7th at 5:30 p.m. in the OSC Ballroom. This is open to the public and greater Pueblo community. If you can't make it in person, you can watch it on Facebook Live on Mayor Heather Graham's Facebook page. The Team Up to Clean Up Free Dump Day is Saturday, October 18th from 8 a.m. until 3 p.m. Clyde's going to put it up. Give him a second so everybody can see. Don't miss out on 3 different locations, including CSU Pueblo and the Colorado State Fairgrounds for household trash, bagged grass and leaves, and up to 9 tires off the rim, large items and more. A 3rd location at Recycle Works is offered for yard waste like tree branches and shrubs, but must be unboxed and unbagged. No oversized trucks, no commercial vehicles, no electronics, no hazardous material, and no concrete supplies can be disposed of at this event. This event is free and open to City of Pueblo residents. Please bring an ID or utility bill with your city address. Let's clean up Pueblo. Pueblo Parks and Rec. They're holding a candy drive for 2 upcoming events, including the Haunted Rides at City Park on October 17th from 5 to 8 p.m. and October 18th from 2 to 8 p.m. El Centro will also host their trunk or treat October 25th from 4 to 7. We're taking candy donations all the way through October 23rd at either location at the Pueblo Parks and Rec Admin Office Building in City Park or El Centro del Quinto Sol on 609 East 6th Street. Just so everybody's aware, the Colorado High School Activities Association 4A Boys High School State Regional Tennis Tournament at City Park will be Thursday, October 9th through Saturday, October 11th. And the 4A Boys High School State Championship Tennis Tournament will be the same place, October 16th through Saturday, October 18th. Next, Clyde, if you could put up the PD slides. We'll go through these. Maybe. All right, just on the slides, if you're looking at it, you can see that loitering this year to date, we have 891 citations, which is up 40% from last year, with 22 loitering by minors after curfew and 85 curfew in the parks. This chart, the next one breaks down the Part 1 crimes compared to last year, which shows Part 1 persons is down 11% and Part 1 property is down 4%, with the total Part 1 crime down 6% from last year. And it kind of goes into the details if you look at that. On the next slide, with shootings, you can see that we have a 16% decrease, a 10% decrease in non-fatal shootings, with a 20% decrease in drive-bys and a 41% decrease in homicides. In addition, last week in patrol, the following occurred in addition to handling almost 2,900 calls for service. The DICE team issued 12 loitering citations, 2 theft citations, 2 drug paraphernalia citations, 4 no camping citations, 3 warrant arrests, and helped with several homeless camp cleanups, assisted the sales tax division with issuing citations for sales tax issues at several locations. Watch 1 had 4 loitering citations issued, 2 warrant arrests, 3 PR bonds issued, 8 trespass citations, and 6 traffic citations. Watch 3 had 1 misdemeanor warrant arrest, 1 felony warrant arrest, 5 citations for loitering, 14 traffic citations, 2 trespassing citations, and 12 failures to yield on traffic stops. Conducted over 224 self-initiated calls in this area, including 134 COP calls, 18 walker stops, 9 suspicious vehicle contacts in the Northern Avenue COP area, Abriendo Mesa Junction area, and downtown area. In addition, due to proactive work, officers discovered 1 unreported unsecured business on Union Avenue with 1 unreported property damage on Union and seized 1 firearm from a fight menacing at a downtown bar. With that, that concludes my report.
Okay, any Councilor Joe Latino?
Yes, thank you. Brian, I want to ask you a question about Spring Hill Suites shootings after what we had the airport event here on Saturday and Sunday. I understand there were shootings at the airport at the Spring Hill Suites. Is that correct?
As far as I know, it was not at the Spring Hill Suites. I believe there was a shooting that was on the
The shooting was on the interstate and it involved 3 different cars who were shooting at each other, and the spray of bullets hit several parked cars that were at the Spring Hill Suites,
Okay.
but it was not located
Yeah.
on the hotel.
So in essence, what you're saying basically is that the shootings were taking place between 2 different vehicles and they happened to hit the vehicles at the Spring Hill Suites. Is that correct?
Yes, off the
And those
interstate.
people were here from all over the state and surrounding states for our air show. It's a concern that I have, and that's why I'm asking the question. In terms of where we are as a community and the latest statistics that have come out, and we may agree or not agree, but we're ranked number 10 in the country out of 20,000 cities and towns in crime. That's a concern.
Okay,
Thank you.
okay, Council Maestri, please.
Were we able to get our application in for the bathhouse with the historic preservation grant funding?
We had the meeting, Counselor Maestri, that you and Counselor Flores and
Mhm.
Counselor Martinez, I think sat on. The application was not submitted for the October first funding. They are gonna try again for the spring funding. We have not received from the Friends of the City Park any of the information about the deadlines for us to be able
So
to.
why
put the
didn't
lead
we get
together.
why didn't we get it for the October? That's what you had said, that we were going to.
Correct, they
get
never
it?
submitted any of the information to us.
Well, I thought that they didn't have to, that we just were able to tag it and hold it.
No, they needed to send deadlines to be able to put the lease together to then be able to submit for that first round of grant applications. So we're still waiting for that information to come from the group. And then they'll be able to apply for the first round in spring.
Yeah, I don't remember that direction given to them. It sounded like they didn't have to be they didn't have to have a historical designation on it.
They
didn't have
don't, they have to have a letter of intent, an intent to lease, an intent to take over the property. And that information was only going to be able to be put together if they submitted their milestones in which they thought that they were going to be able to meet to submit that October 1st.
Okay, then also, have you thought about that for the recreational, Parks and Rec admin? Have you thought about a grant funding to get that back up and operational? Or do you have a different plan for that building?
I don't know what you mean for Parks and Rec admin.
The Parks and Rec admin building that you said that had mold issues,
The
Yeah.
annex,
the annex, yes.
those employees are working in the Dittmer building.
But did you, since those buildings qualify for grant funding, did you put anything in for that?
No grant application has been submitted for the building that's full of mold.
So is that building tied to the hall?
I think the
So-
building maybe you're talking about is the Parks admin building,
Mhm.
right around the fountain to the right when you come in through
Yeah.
midnight. That's not the annex building. The annex building is the building that's closest to the tennis courts on the backside by the zoo.
So what is the building that's
That's
there by
the
the
Parks
fountain?
admin building.
That's the Parks admin building by the fountain.
Yes,
Okay, so that one doesn't have a
No,
mold issue?
that one is full of employees.
Okay, all right, thank you.
Sure.
Council Flores, please.
Back on July 27th, I was wanting to see whether the mayor or Brian could follow up on this for me. Back in, it was June 27th, I'm sorry, it was June 27th. There was an article that came out that Core Civic, one of the largest private prison companies in the US, is prioritizing the 2 dormant facilities, one in Burlington and one in Walsenburg. The one in Walsenburg is called it's called the Huerfano County Correctional Center in Walsenburg. And it's been mothballed since 2010, so it's been sitting vacant for 15 years. Currently, in the state of Colorado, Colorado joined a list of states banning that state or local governments from entering into ICE contracts for public jails and prisons, but the legislation does not include private-owned operated facilities. So whether or not ICE opens up that prison in Walsenburg is really up to the government there, I guess, in Walsenburg. But I had heard that there is an airline service that potentially the city is involved in that would allow planes bringing in illegal immigrants into our airport. And I was just wanting to know if the two of you know about anything about the city entering into any agreement with an air service that's going to be sending illegal immigrants into our airport and then bus down to this detention center if they open it up.
No, anything I know about the ICE going on with the Civic Corps is just what I read in the paper. I know that that's a hot topic right now. I do know that one of the contractors at the airport does have federal contracts for refueling, but that's the most that I would.
Now, this goes beyond that. This
Yeah.
goes into actually transporting illegal immigrants with ICE agents into our airport. And the story I got is that our airport director might be in talks with them, and I need to know whether this is happening. The community needs to know, because I got to tell you, this would be very offensive to a lot of people here in our community, especially the way they're operating. And I just want to go on record. And if our director at the airport is in talks with any kind of air service that's bringing in immigrants just to go bus them down to Walsenburg, I need to know whether or not that's occurring. Thank you.
Counselor, we can have Greg from the airport. We can have Greg from the airport come and give you an update. It's Freeman, right?
Freeman Jet Center.
Freeman Jet Center does do the fueling for federal aviation that does land at our airport. And there was an inquiry from Freeman Jet Center to our airport about getting him or them in contact with Walsenburg.
It was Walsenburg. It was the city government down there, Walsenburg, but it
But that's the
wasn't.
extent that we know. So we'd be happy to have him come and give you additional information, but that's all the information that we have.
You don't mind.
Yeah.
Sure.
Oh, people think that that kind of contractual arrangement, councils should know sooner than later.
And I don't, it's not a contractual arrangement with the city. They're just on our airfield, Freeman Jet.
I'm not talking. Microphone. That needs to be a little. Said, I'm not concerned about
Sure.
refueling. I'm concerned about bringing immigrants in these planes into Pueblo. It can't be any simpler than that.
Sure, we can have him come and
Okay.
give you an update on any correspondence that he's had with Freeman.
All right, thank you.
Okay, anybody else? Any other comments? I think that's good. Okay, next up, item agenda B is going to be employee health clinic update. Marissa Pacheco, Director of Human Resources. Keith Jamtas, I guess, Associate Assistant Principal. And Carly Dahlsmith, Associate Account Principal, 30-minute presentation. And does anybody else come up with you?
No, just me to start, and then they'll come up after me.
Okay, all right, it's all yours.
Thank you. Good evening, Mr. Chair and members of council. Thank you for this opportunity to come and give you an update on the city's employee health clinic project that we've been working on. In terms of our agenda this evening, I'm going to cover project history and funding, and then introduce you to our selected clinic provider, which is Crossover Health, and then talk about next steps. So in terms of project history, the clinic is not a new concept. This is something we've been working on for a number of years and is part of a long-term cost control strategy. For any health plan, including the cities, there are really three primary cost drivers for us. One is plan design, which is nuts and bolts of any plan, co-pays, co-insurance. What does the plan cover? That's plan design. Plan use, how much the plan's being used, what kind of claims are hitting the plan. And then the third one is cost to deliver care. That one we have very little control over because we're at the mercy of providers in the community. Whatever rates they set, that's what we end up paying through insurance. That would be true unless we had our own clinic, which is part of the reason why we're here tonight to talk about that. Again, these are our drivers of cost on our healthcare plan. We have been taking steps to control costs, the first of which occurred in 2019 when the city moved from a fully insured health plan to a self-insured or self-funded program. That gave us much more control over the plan. We've already seen quite a few wins with that. Our premiums have been lower than others have experienced. We had 3 years in a row where they were zero. So we are really seeing some cost control with respect to being self-insured. The other thing that self-insured does for us is it allows us to build a healthy reserve. And the way that we build that reserve is in claim years, when we don't have as many claims hitting the plan, we get to keep that additional money at the city. When we were fully insured, that money went straight into the insurance company's pockets. So we've been able to build a healthy reserve, and that's integral to our discussion this evening because that's part of our funding strategy. In terms of the clinic itself, we've done a lot of heavy lifting to get to tonight. We started several years ago by doing a very deep dive feasibility review, looking at our plan's performance, reserve analysis, working with Hub, who's actually on the line with us as well tonight in case you have questions for them. We wanted to make sure that the clinic was a logical next step in our cost control strategy, if it was fiscally responsible and if it was even possible. Once it became clear to us that it was something that we should investigate, we then, through Hub, launched a nationwide RFP process to identify clinic providers that could come in and run a clinic for the city. We narrowed it down to several finalists, and then we really started our due diligence activities. Externally, we did interviews of the providers, we did site visits, reference checks. We got to know these providers, their culture, their approach to clinic services, made sure that they were financially stable. So that was our external due diligence. Internally, we also did due diligence, one of which was an employee survey. We asked our employees, is there even interest in a clinic? Would you even use it? So here's a couple of points from that survey here that you have on the screen. 92% of survey participants stated they would be likely to use on-site health services. 84% stated that they would be most interested in primary and urgent care services. That was important to us because that's the starting point for this model is primary and urgent care. So once we selected our clinic provider, which is Crossover Health, we then identified a site for the clinic. The Dittmer building is pretty much ideal for this. The first floor was a clinic before, so the changes to the clinic are minimal. We're talking paint and a couple of doors. It's plug and play, ready to be a clinic. So we went through that process, identified the site, have brought this to you on a couple of previous occasions, and that gets us to tonight. So that is essentially the history of the project to today. So now I'd like to talk about project funding. How are we going to pay for this, and how is this going to save us money? So the health insurance fund is funded through benefit premiums that are paid into that bucket every month. The employees pay into it and the city pays into it. We do that to a tune of about $14.5 million per year into the health insurance fund. Out of that bucket, then we pay claims. We pay for our third-party administrator, stop loss insurance, any fees associated with running the plan. In 2024, as an example, we spent $13.8 million. So that means that what we're putting in is outpacing what we're paying out. And that is why we have a healthy reserve of $6.5 million available to use for healthcare expenses. This cannot be used for anything other than related to benefit plan functions. So the good news is that we're not asking for any new money for this clinic. We have the money to do that in our reserves. So not one new dollar is being requested. We are requesting to pay for clinic services out of those reserves. It's going to be about $900,000 a year, which sounds like a lot, but once you learn more about what it's going to save us, it becomes very much more attractive, and Crossover will talk a little bit more about that this evening. So that's all well and good. We have the numbers, but how is that going to save us money? So this is how it's going to save us money. There's a number of different ways. First of all, any clinic services that occur will never become a claim that hits our health plan. We'll never be paying out of our health insurance fund in that respect for a claim. So that's helpful to reduce our plan use as one of our cost drivers. We also will be paying less for the care. So employees and their families will pay significantly less to go to the clinic. Many will pay $0 to get the care that they need. If you're on a high deductible health plan, the IRS requires that you pay a small fee, so they will have to pay a small fee for that. But bottom line, in the end, our employees will pay less and the city will pay less for those services than they would had they gone to a provider in the community. And we have data that supports that. An ancillary benefit to the clinic is we have a PCP or a primary care physician shortage in this community. We hear that consistently from employees. In fact, on our employee survey, many reported that they don't even have a primary care physician. And if they do, it takes them weeks to months to even get an appointment. So part of the benefit of this clinic is it will free up all of those appointments for citizens in the community that would have otherwise been taken by our employees and their families. So we feel like that also is a benefit. The clinic will also save the health fund money through preventative care. The way that these clinics are structured, and Crossover will talk more about this, is it really provides an opportunity for our employees and their families to establish primary care relationships that focus on disease management and preventative care. If we can get people taken care of before they have a serious health issue, we'll have improved health outcomes and less spend on the plan. We also believe the clinic will have a positive impact on productivity of staff. Because it's a dedicated employee city clinic, people can get the care they need and get back to work more quickly, reduce lost time. If I come into work, I have a sore throat, I can go to the clinic, have a strep test, they give me antibiotics right there, they'll have a limited pharmacy on site, I can go back to work. So we do believe that will be a benefit, and the model that Crossover Health has across the country will bear that out as well in their comments to you. And finally, we believe that this is investing in our employees. We believe that this will become a retention tool as well as perhaps attracting new candidates to join the city. We all know it is less expensive to keep good employees than to replace them. So what does that look like in terms of hard dollars? I know that's an interest with council and the budget coming up. And Crossover is going to talk to you a little bit more about that, but I can tell you the amounts we're looking at are in excess of $1 million in savings within the first 5 years of having this clinic in place. So before I turn it over and introduce the Crossover staff to make their comments, we also will have this savings. So we will be having the clinic perform all of our post-offer employment physicals, drug screening, and fitness for duty evaluations. So that's about $56,000 a year that was hitting the general fund, which will no longer hit the general fund. It will come out of these clinic services. So with the projected history and funding covered, it's really my privilege tonight to introduce the Crossover Health team. We're pleased that they're able to join us tonight to tell you about what they do, how these clinics have been successful all across the country. And with that, I will turn it over to the team.
While they're coming to the podium, just want to make sure, Council Martinez, are you online? Can't see.
Yeah, I'm here. Thanks, Chair. Sorry, did you ask if there were time for questions or no?
I was just asking if you were online. I'm sorry. I just wanted to make sure you were there.
Yeah, I'm here.
All right, thank you. Okay, guys, it's all yours.
All right, yeah, that's a tough act to follow. Thanks. All right, let's see if we can get this going. This one. Introducing us. Awesome. Nice to meet you all. Thanks for the opportunity. We're excited. There's a little picture of one of our lobbies in one of our clinic. And do a quick introduction. So as you already mentioned, Roger, my name's Keith Jamtos. I'm an account executive here at Crossover, coming to you tonight from Reno, Nevada. So this has been a really cool experience. Excited to share more about Crossover and the exciting things we're going to be able to do for you guys. And I'll let Carly introduce herself and then we'll dive in.
Yeah, and I'm Carly Dolmseth. Very nice to be in front of you all tonight. I'm one of the associate account principals over at Crossover Health. So I'd be working very closely with all you post-implementation. Once you're signed on as a client, I've been with Crossover for just about 5 years now. So I'm really excited just to talk through some of the things we can do for you.
And maybe before we jump in, were there any questions ahead before we jump in? Because that could also help us dictate in terms of the conversation for the rest of us here. So,
No, I think we're fine.
okay, awesome.
Great. Well, I will keep it going. So as Marissa covered, you'll see that we have our services covered across all 50 states here. And those little dots there are what we call our on-sites and near sites. So near site would be a shared health center. So very much like you would go out into the community, multiple employers can buy into it and use the services. An on-site is what we're proposing to do here with the city of Pueblo. And that would be a custom center designed for the employees at the city to be able to use as they see fit. So we'll go a little bit more into those services, but primary care, occupational medicine, things, acute care, same-day sick care, et cetera, that we can cover for them. So that's kind of what we're offering here. And that's just a little bit about crossover here, our vision and mission. Our role is to really make our clients the most successful that we can. So we hope to inspire, we hope to design something amazing with you so that we can walk away and say, we did something different, we made an impact on a population, and we ultimately made a change to the healthcare outcomes that we're seeing. And this one here is just a little bit about what our model looks like. So you'll see the member in the center there, and they have access to what would be our NPs, so our nurse practitioner provider, a medical assistant, care navigation, and of course we would offer OCMed. They would have access to this team both in person as well as virtually, and what we also consider messaging. So it's very simple for a member to request a prescription refill, avoid an ER visit and quickly message the team and say, hey, I might have some strep throat, or maybe I've got pink eye, or what can you all help me with? And they can address that in a timely manner. When a member comes into the clinic, we really pride ourselves on there being no wait time. And so our goal is to have a member in the room within less than 5 minutes of arriving, and then a provider would come in within less than 5 minutes of that time as well. We do a lot on site with our labs, and so typically an annual visit would look something like a provider or an MA coming in. They would draw your blood, they would go ahead and take that back and start running the results. In the meantime, your provider is coming into the room already, and you get a full 60 minutes with them, which is not very common in the community. So we're really focused on not doing a fee for service, but really doing your whole health. Our objective is to actually see you as little as possible. We really want to make you better. We are not incentivized with you coming into the clinic multiple times. So that's really what they focus on. And then at the end of the visit, your labs are done, so you don't have to wait. And actually the provider will review it with you live in that visit, which is really great to be able to see what are your next steps. Do we need to book another appointment? Maybe you need some specialty care that we can't cover. So we would send you out to our care navigator who finds someone in the community that would be cost effective, and they make sure that it's a whole closed loop circle for you. So they help you book that visit. They make sure that you get in there, they'll get your results, and they'll send it right back to our crossover provider so that we can go ahead and finish your care for you. And this is just a little bit more detail about some of the services that would be offered at the clinics. I won't go too much into all of these, but we talked about annual physicals, any screeners that might need to be done at that time would be done there. Any vaccines or flu shots, we have all that on site and be taken care of. Then we have primary care. So again, just your overall management of anything acute that could pop up. That's really where our same-day sick care visits come in place. So you wake up one morning, we always save slots for people to be able to call in. So you don't have to go to the ER if there's something we can help you with. There's lab services, as we had mentioned, and then some general RX dispensing that we would do on site. Anything ongoing, we would of course send to a pharmacy, typical anywhere else. A lot of the acute care, so again, minor cuts, scrapes, bruises, cough, strep, whatever it might be, we can handle there. And as I mentioned, the virtual and messaging care. So again, if you're not feeling up to coming into the clinic, you just send a quick message to us and we'll help address that for you and let you know if you actually need to come in. Maybe we can just get you a prescription. Maybe you do need to go to the ER, but it's at least that first step before going right over there. Occupational medicine, talked a little bit about this. So again, those work fitness exams would all be done there. And then we're also opening this up for dependents. So we do pediatric care for 3 and up. So sports physicals, again, that same day acute care that we can support as well.
All right, I guess
over
take
to
it
you.
over. Nice job. Any questions that popped up during that, or should we just keep rolling?
Keep on rolling.
All right, so I thought it'd be fun to dive into why people pick us. One thing we didn't touch on, we've been around since 2010. So that map you saw, we've grown organically over the years by doing this type of work for clients and why they select us It's really about that trusted team-based care model. Typically, if you're going to get a primary care appointment in the community day, you're lucky if you get 20 minutes. You're going to get a 60-minute appointment and you can book it that next day. So that care team is integral to our experience that the members are going to have. Carly touched on account strategy. I have another slide that'll come up here next that talks about our retention rate. When we get clients, we keep them and we grow with them. And that's a huge part to what Carly and her team does, along teaming up with Marissa and Bella there on the HR side, to making sure that clinic is rocking and rolling. The member experience and the tech. So we own all our technology. We've built everything over the past 15 years to make that a seamless user experience, from messaging in our app, booking appointments, everything you need to do right in the palm of your phone, and provable value, which is going to tie into what we're going to talk to next. I mean, I often will joke, you can't be around as long as we have without driving real results for our partners and our clients. So there's a lot of numbers on this slide. So I'll just kind of highlight some of my favorites. But in terms of if we're thinking about themes across the two, Marissa had mentioned not having control, right? When a member goes into the community, typically it's based on a fee for service. That doctor is incentivized based on a volume-based structure. That is not a mutually aligned structure for anyone. That doctor doesn't want to practice like that. That member wants to spend more time to actually have that trusted relationship. And the employer of a self-funded plan, you're paying it. It definitely doesn't align with your values, right? The way we think about it, it's got to be mutually aligned for everyone. The city employee, the city of Pueblo, and that clinical team as well. So everything you see on the top is the advantage of coming direct, right? So you're going to take control of that last bucket, that number 3. And so these are just some examples when you can bring that in-house, lower ER visits, reduction in employer healthcare spending, which we'll talk about when it comes to ROI, cost savings on specialty referrals. Our care navigators will do an amazing job of only referring to low cost, high quality care providers, because there's a lot of extra expense in there, referral lower visits, and just better clinical outcomes. The bottom are really the results of a care model like ours, that team-based care model. So that's everything that we're actually going to do to keep the population healthy and get them healthier than they are today. All right, what we're all here for, it sounds like, huh? What's our return going to be here? And so we've kind of laid out projections over 5 years, what we're estimating that the clinic can save the city. So when we think about, there's really 2 key buckets here when we try to set up an ROI forecast. One is looking at your current spend. So that's without crossover. So if you just left it as is, that trend's just going to keep going up and up and up and up. Right? But when you look and you bring in the services like crossover has, we can tell the difference between the cost of a crossover member versus a non-crossover member. A crossover member is going to be around 30% cheaper than a non-crossover member, to give you a sense there. So that's one bucket in terms of sort of where we look at the financial analysis. The other is going to be the productivity savings, the access of having that clinic right there, the time saving that's going to happen there. So those are really the 2 variables when we look at putting together a projection like you see here. A lot of it's based on what we anticipate for engagement in the clinic. So these could be lower. It's just based on how many people we're estimating the first year that we're going to see, second year, and so on that trend. But hopefully they're actually a lot higher than this. So I'll take a pause there. Any questions?
No, I think we're good. Virginia, you have something?
I have a lot. Questions, but I'd like to wait till the end.
Okay, we're fine.
All right. And hopefully if we ever get the opportunity to come back, these will be all quotes from city employees. But here's just some folks sharing the stories of their experience with crossover and how it's impacted their lives. And then going into next steps.
All right, thank you to the crossover team for sharing those updates. So in terms of next steps, the facility update is something that we need to accomplish. As we were discussing earlier with council, that we have employees that were in that Parks Annex building and had to be moved for health safety reasons. And so they are in the first floor of that building now. They'll be moving up to the second and third floor of that building. And then that clinic literally will be plug and play. We're talking paint on the walls, a couple of doors, and that will be paid from the self-insurance fund as well. Council will next hear this on November 10th. We'll be bringing a resolution for the contract approval with Crossover Health. And then really we're off to the races to equip and staff the clinic and have a launch in second quarter of 2026. So, this is an employee benefit. There's no doubt that it is a benefit for employees, but it is also a benefit to the city because it is going to save us substantially in the long run. And so we're excited about this project and really appreciate council's time tonight.
Okay. Any other Council Flores, I'm sorry. Council Flores?
Yes, I always like to talk about health insurance in our city, and make a statement. And that statement is that the city of Pueblo, since we started self-insuring, has been a tremendous benefit to our employees. And that's because we're almost in control of our own destiny. But the product that we have through the national broker, Hub International, they have done some amazing work within our self-insurance program that I don't care with any type of organization where you're having to deal with with unions and with contracts, that the health insurance has hardly even made a blip as being part of that. And that's very unusual. There are governments throughout the United States that sometimes the raise becomes only the increase in their health insurance as being the only thing that can be affordable. In our case, and I don't think our I'm gonna have to get spotted.
Okay.
In our case, we don't necessarily have to worry about incorporating our health insurance costs because they've been so flattened out since 2019. But I did have a question regarding a couple of comments that you made. First of all, you did indicate that you have a model, but you also said that you were preparing to design something. Was that, did you mean looking at our community and maybe the needs of our community, and maybe your staffing would be modified depending on the city that you're in? Is that what you meant by saying that you were going to design a model, I guess, for our clinic?
Yes, so we have our standard model, but we really want to partner with you all for what exactly you need. And so that's kind of where the design thing, everything comes into play. So, you know your population best. So it's really like, who are we hiring? Does it fit the population? Maybe as we launch, we start to realize there's a really high diabetic population. Maybe we would benefit from a health coach or someone else who can kind of support. So that's really where this whole customization and figuring it out for you all comes into play.
Is the contract that we potentially will enter into, is that based on encounters or a fixed amount of encounters?
It's what's called a cost plus. So all salaries, wages, and benefits of the staff are passed through. So there isn't anything that's based on a volume based. So they can have as many visits, lab draws, all of that's included within the cost plus model. How Crossover makes money is just off a management fee. So managing and running that clinic.
Okay, and then is there any kind of remote medicine that you guys provide? Say someone's sick and they just want to zoom in and get some advice. Can you elaborate on that?
Yeah. So we do offer virtual care with your same team. So the way the schedule is typically built out is you have the opportunity to book in person or virtually. So if you're at home, you Zoom in, that's what we use. You would be able to see your provider that way. I also mentioned messaging. So maybe you don't even need a Zoom to talk through something. It's as simple as, hey, I've got a rash on my arm. You send a picture over and the team can help you that way.
Yeah, believe it or not, we have, we have employees that potentially, I mean, they live in Colorado Springs or Canyon City. That's 40, 50 miles away. We have a few that live in Denver. I mean, it's, so that would be a huge benefit for them, the remote kind of thing. You get someone that goes into the clinic and they need hospital care. I mean, this goes beyond your capabilities. What kind of contractual arrangements or networks are you intending to build? Obviously, we only have 2 hospitals in our community, but there are other care providers that do a lot of other things. How do you intend to formulate and put that together?
Yes, so we work with our team of care navigators is what we call them. And so they do a great job at looking at the benefit plans that you all have and going throughout the community and seeing what kind of services and partners that we would want to get with. We also then, if we send someone to a specific hospital, maybe a specific provider, and they have a really bad experience, we also survey our members. So if they come back and say, hey, we didn't have a good experience there, or my insurance didn't cover this a certain way, you know, and you guys thought it was going to be, we mark that all down. We help them through it if need be, and then we wouldn't refer to that person again. But they have already built, as I mentioned, we have people already in all 50 states. So they've already built a good relationships here in Colorado. I have a client here myself virtually, and so they would be able to grow onto that.
Our employees would not have to worry about filling out long insurance documents or anything like that.
No,
They just
that was
walk-
part.
Yeah.
Yep, if they do need help with something, again, that's where the care navigator comes into play and will support them through any paperwork. They'll also help someone book a visit if they're having trouble to do so. We've had plenty of experiences and great stories where someone needs to be seen that very next day. And there might be someone who's a wait of, you know, a month to get in. Our care navigators have built really great relationships where we can get someone in quickly and help them out.
How many employees are you going to employ in the city?
In Colorado?
And no,
Or the
in our
clinic.
clinic, the clinic here.
I believe the model is going to be an NPMA.
We'll have 3 full-time staff
Is that what it is? Yep.
And will
and
you
then
be,
virtual support sort of wrapped around it.
and you will be open 24 hours a day?
No,
No. Okay. So what are your hours?
it'll be regular business hours. Monday through Friday, 8 to, I don't remember off the exact.
Yeah, I think we're doing standard business hours, 8 to 5, but then, you know, we've talked about it, that if the needs change over time, they're willing to do some different things. For instance, if they need some Saturday mornings at some point, we have that opportunity to expand as we need to, working with crossover.
Everything's flexible. We
Okay,
could add
thank-
after hours care. We could look at other alternatives. Yeah.
Yeah, thank you very much. Appreciate it.
President Mark Aliff.
Thank you. Thank you for the report. Thank you to staff. I'm sure you've done an inordinate amount of work to get us to this position. So I appreciate that. Just so I understand it completely, if I have a doctor I've gone to my whole life, I'm not going to come to you. So under our insurance, I still can go to my doctor, right? So this is like a voluntary program, but we're still as employees, they're still covered under the regular insurance, right? Okay. The second question I had was on the dollars in the reserve. Is there a law, and maybe Hub needs to answer this, or I don't know who the expert is, but are we required to keep a specific amount in the reserves for what's the dollar amount?
Yeah, so I don't have an exact dollar amount for you, but I can tell you that we've been monitoring our reserves since we went self-funded to see, you know, when we would be comfortable with this. And so there isn't a set amount that we have to keep in reserves, but I can tell you that Hub and their actuaries are very, their underwriters are very conservative. So they really have paused on this and waited until they felt like we could afford this. They are conservative and want to make sure that we have enough in that reserve for a rainy day. Hub is on the line. Sean Seahawk's on the line. I don't know that there's an exact dollar amount for our plan that would make sense or not. Sean, maybe you could speak to that.
Good evening. Thank you for having me. Yes, we have some standards that we go by that we would generally recommend the city keep. on reserve. Again, you've got a very healthy reserve. You more than exceed that. But we would work with the city over time to ensure that the reserve is well funded, at least at the minimum that we would recommend.
So there's no dollar amount. It's just what you recommend.
There's no legal dollar amount, correct? We have some industry standards that we go by with our actuarial team, but there's no legally required amount you have to keep on reserve. That's correct.
So based on the model for the city of Pueblo, what would your suggestion be for reserves?
I have that back at the office. I'd have to turn to our financial consulting team, but we can get that for you.
Okay, I mean, can you just, financial people never give you ballparks.
I know. I'm sorry. I'm home now with the due to the hour. I'm home and I don't even have a file to look at. I apologize, but we will get that for you.
And I can tell you, Counselor Aliff, that we wouldn't even have looked at this if we were not over like 3.5 million at least.
Yeah.
So we would want.
Well, my
to
thought
keep-
process wasn't on looking at this. My thought process was, is it more advantageous to the employees if they have lower rates or a clinic? So if you have X amount of dollars in reserves, can you just lower the monthly rates that employees pay for their premiums?
Yeah, sure. What you're talking about is a premium holiday, and we could certainly do that. The problem is that would be a one-time spend, and it's not a long-term strategy or investment. And it's not something that Hub and their team has ever recommended to us. They are anti-premium holiday. So I understand the cost benefit analysis. Does it make sense to use that $6.5 million in a different way? And we certainly could, but we feel like this is the way to invest to have long-term savings. A premium holiday is not going to get you long-term savings. It's going to get you sort of a one-time shot in the arm. But this is really a strategy to control costs over the long run.
So the last question is based on the savings model that was put through $2 million over the next 5 years, I think it was. So will that increase our reserves by $2 million?
It'll increase our reserves by some, definitely, but we're also spending out. You know, we're paying for the clinic services, so we're reducing our reserves.
That wasn't accounted for in those numbers?
That was accounted for in those numbers. So we'll save 2.3 across 5 years. So yes, our reserve will probably get healthier. That would be the goal.
And then maybe.
And
rates
then
could
maybe
come
we
down.
talk about something else in addition to the clinic. And we, you know, what I love about Crossover Health is that they are very flexible, as they've said. We can expand this and use different services as our population dictates. If we see, like you said, we need a health coach or we need mental health, that's a huge thing for the city right now. We need mental health assistance. We could add that on as a service. So I'm sure there will be opportunities to spend the money.
Thank you.
Yes.
I appreciate it.
Council Maestri.
Okay, so we have 6.5 million, did you say, in reserves right now? And that's been over 6 years?
Yes.
And we have, what is the management fee? Because you're getting a management fee, correct? And then you're getting instead of the insurance paying the patient's doctor, they're paying the clinic, correct? Okay, so what is the management fee going to be? Because you've made a proposal, right? And that's public information. So the fact that you give it to us now is not some hidden secret.
No,
Is
usually it's
it-
around 7 to 10%.
7 to
In
10%.
that range. So we're basing it off the salaries, wages, and benefits of the clinic staff.
So the
Oh, so you
nine,
haven't gotten that far yet.
No, we have.
so the 906,000 is kind of what we're
Yeah, and then so we would make a percentage of the.
of that.
Yeah.
So that 906,000 pays for the salary and benefits of all the staff, the management fee, the supplies, the equipment, the RX, the vaccines, that's covering those costs for.
Annually?
Clinic. Yes.
Annually. Okay, so, I mean, just simple math wise, if we are going at the rate that we've been going and we've made 6.5 million since 2018, and we're only gonna make 2.5 million in 5 years. Cost savings. How it, that doesn't, because this was 6 years for 6.5 million.
Right, that was 6 years of doing nothing to try to control costs other than
Mhm.
going self-funded. So adding this into it, that 2,322,000, whatever it was that they anticipate in savings would be in addition to anything we have in our reserve. We're gonna keep building our reserve.
Well, that's right, because the
Right.
2.5 million is gonna go
Exactly.
into it.
Yeah.
But didn't we do 6.5 million by doing nothing over 6 years?
We did. We were very fortunate. I can tell you, and I think Hub will back me up on this, that was an anomaly that we have been as successful as we have been in building that reserve. And the reason why is because we went self-insured right when COVID hit.
Mm-hmm.
And so many people deferred their medical care. They didn't go get medical care. So all those premiums were going in without the claims coming out. So we had this
So we have a different-
bonus.
So as 2022, we had high reserve amounts going into the reserve. What about the last 2 years?
They have been
Lower?
less
Less?
than the initial surge of money into the reserve.
And did you think about, let's see, does anybody else have a question? And I'll come back to it. Or no one, let Dennis know.
Flores?
I don't have a question, but I want to attempt to answer the question regarding what our reserve is. We would never know that without the actuaries that actually calculate our loss ratio.
That's correct.
And so what happens in this kind of self-insured environment is that you have specialists that will dictate what your stop loss would be too. And most people don't understand that if we have a transplant case that costs $2 million, that the city of Pueblo is protected by not only paying up to a certain point. It could be 150,000, it could be 250, it could
75.
I figured it would be in that range. And so the actuaries look at our past loss ratios, the potential of what's going forward, and they look at how much our self-insurance is going to cost. Because if we have that kind of case, we have an insurance policy that will pay over the 175. So it's a number that you cannot say is going to be exactly X. It's a much more complicated thing, and you have to trust the actuaries actually know what they're doing. And in our case, they've had a pretty good record for the last 6 years of keeping our rates low, picking the right stop loss, also giving us the right they actually have to come to terms as to what they would expect based on age and everything else of what that's going to cost in the future. So when you were trying to answer the question about what is our reserve, it's a moving target all the time, depending on our losses, depending on our stop loss, depending on what the actuaries, I picture somebody like a sausage machine as the actuary, and whatever comes out there, that's it. But we can actually say in the city of Pueblo, we have a great program. We have people that know what they're doing. We have a great stop loss. And I wouldn't do anything with our plan until we see how this is going to. This has the potential of even bringing our losses even lower. And, so somewhere down the line, the bottom line is that we've got a good plan for our employees, and we should all be happy about that. Thank you.
Okay, Council Maestri,
How
please.
many employees do we have again, Marissa?
Oh, gosh, I wish I had that exact number. We're authorized for 849. I believe we have 730 something.
Wasn't in a previous presentation, they were saying that it's more successful when you're in the closer to 2,000 employee mark?
More
Well,
successful.
As far as generating the operating expense, revenue in order to, for one of these to successfully?
Well, but it's not just, you have to remember it's covered lives. So it's not just our employees, it's their family. So we're at about 1,800 belly buttons is what I like to
Oh,
call
okay.
it, that are actually covered that would be eligible to receive services.
Okay, and then also, we have 92% likely. What is the actual percentage that it needs for the employees to have to participate in order for it to be successful?
So you guys question.
Yeah. Do you have, in terms of adoption percentages?
It varies. As far as what we put in our ROI model, I'm not for sure, but typically our first year is right around 20% penetration is what we call it. But again, that's where we really leverage, you all in the relationship. Once word gets out there, people come, and word of mouth is very, very strong. So I had one of my clients, they were about 50% penetrated in the first year, and they're close to 90% now.
Mm-hmm. Okay.
It'll
Yeah.
build over time.
Yeah, I know there's been, just seems like the Pueblo people like to stick with their doctors until they can, till the doctor retires in this town. So I just wanted to see what you felt. Cause see, my question is say the first year goes through and we get 20%, you guys aren't happy with what you're making and the city isn't happy and things go to, how much is that just going to cost us the money that it took to operate that year? Or do these contracts go for several years? Are they on an annual basis? Are they every 3 years, every 5 years?
It's all you, but
Yeah.
Because
They vary. This would be for 3 years.
it'd be for 3 years.
And then we'll build in performance guarantees along the way as well. And
Mm-hmm.
those also will build each year, depending on the types of things that you're trying to measure.
Mhm.
The first year is definitely focused on activation. So getting people in the clinic, meeting their care team, booking appointments.
And would you say that, so it's 906,000 a year approximately for the management fee? Is that annually or is that for the 3
It-
years?
No, that would be annually, but then with inflation, so that those costs will rise
They'll rise with inflation.
every year. Mhm.
So what happens after, say it's not successful for you after the first year? What happens at that point?
Yeah. I mean,
Because we're sort of in a recession. And we don't know if we're gonna go deeper into a recession, or is this the time to be doing this? I guess is what we have to decide on the dais.
Yeah, so as I mentioned, I'm the post-sales side, so I would work very closely with the team here. We do monthly check-ins as well as quarterly check-ins just to see where everything's at. So, if we're sitting at 6 months, maybe we're not seeing the utilization that we want to, what are some different tactics we can do to maybe bring that up? Another thing to consider, I've done it with clients before too, is, maybe we need to reduce hours, and that helps, the city because the cost plus model that Keith was kind of going over, your cost would go down, right? If we maybe go down to half the time, because maybe you don't need that much access right off the bat. So that's something that I'm actively monitoring with all my clients. Maybe you guys knock it out of the park and utilization's so high and we need to bring on another provider, but we could leverage that too with the cost savings.
And you don't offer any specialty services though? Like, that's when the costs get really high, is when you have maybe cancer or liver or any one of those problems. You don't offer anything like that. You would be just primary care, correct?
We'll be starting with primary care. We don't do anything with cancer, but we do, Marissa talked about it, mental health coaching, physical therapy. We can expand in those services.
Well, and I would also argue that part of this model is preventative care. If we can catch that cancer earlier because they're in there with a good relationship with the provider, then we're going to save the plan money if we catch that. So that's we want those relationships to be built on the preventative side and disease management side.
All our providers have screening goals. So that's a big piece of it as well. So catching that early.
Mm-hmm. Okay, thank you.
Council Flores.
I just wanted to bring this down to a really finite level, and that is what we're doing here is avoiding the ER. That's the model here. We aren't going to be diverting our employees, giving them much more time, much more attention going through your clinic and avoiding what's probably a $2,000 bill by just walking into the emergency room. So if you want to simplify it, that's what we're avoiding here.
And unfortunately, we have a lot of employees who go straight to the ER right now. So we're hoping to stop that. That's part of that care navigator concept as well. For the specialty care, they're going to have somebody that costs out, you know, this person needs an MRI. Let's not send them to Parkview. Let's send them to Open MRI, which is less expensive as an example. They can help with that.
Councilman Estree?
Spend money.
In that case, do they have coverage for like urgent cares underneath
That's
their
what that
plan?
would be as well.
I know, but currently
Yes,
they do.
yes, they have urgent care available.
So do you think that there would be a difference of them going to the ER as often? Because it's really
do.
kind of after hours, right? Correct?
I wish it was, but we have a lot
So
of
do you think it's
employees that
gonna
use it,
prevent-
they use it as primary care.
During the middle of the day?
Yes, unfortunately, we have a lot of that and that happens unfortunately on our high deductible plan because they feel like they've met the deductible, so they're just gonna go to the ER for the sore throat. So we're hoping to change those patterns and we're making progress in that. Our employees are becoming more and more educated now that we're self-funded, that these are dollars that we can use to support them in different ways. This is one of those ways. So.
A good education class would probably a good.
Oh,
good
that'll
start.
be key. That the crossover team will have a lot of work to do on engagement. This is very much a build it and they will come type concept, but there is a lot of evidence out there with their clinics across the country that this does work. It does control costs. And so we feel like it's time to try that.
All right, thank you.
Counselor Martinez, are you still there?
Yep, I'm here. I just have one question. Thank you for that presentation. I think that this is going to be really great for our employees and for the community because the more that we can have those services in-house, the more it'll free up spots at other places and free up more for the community. So I select the positions that will work in the clinic.
What was
We
missed the question. You were kind of breaking up. Were you asking what were the positions that were going to be in the clinic?
And how they're going to be selected.
Oh, okay.
Yeah, we have a great recruiting team. So we'll go out there in the community and find someone who not just fits crossover as model, but also would fit with the city of Pueblo. So again, our care model, we're planning to have an NP and then an MA. And so they would be supporting the clinic for primary care there.
Counselor Martinez, one of the things that I can tell you is that part of our internal due diligence was to meet with the benefits committee, which has representation from all three bargaining units for the city, as well as Transit's bargaining unit. Management is also on this committee. And when we took this to the committee to get their input on whether we wanted to move ahead, within days of that committee meeting, I already had phone calls from people on that committee saying, I know somebody in the community that's interested in working in this clinic. Will you let us know when this is happening? So we already have several nurse practitioners in the community that have expressed interest. So we're hopeful that the recruiting will go very smoothly.
Is that it? Okay, then I'm gonna throw a question in real quick before I get lost. But I went to your map, the Crossover Health Center, now got the map on the middle of the packet, and I was just curious. I was looking at the numbers of. We have one in Colorado. We have several in other states. Is there an advantage to having more than one, or costs go down because you have a regional approach or a state approach with that many nearby facilities and on sites? Is there advantage to that, or does that work that way at all? Do you reduce cost at all?
I was gonna say, I think for the city of Pueblo, starting with what we are presenting, I think is the best way to go. Again, the map is maybe a little confusing because there are multiple clients
Yeah.
in different spots, right? So, you know, we have a bunch in California. Those are all different clients, and it's not one client having 15 different things,
Okay.
for the most part. We do have a lot of people that buy into our near sites. And so again, those are the shared health centers, which that does help if people are traveling. So we have a lot of, big companies that we partner with, and they are sending people from California to New York, so they can still get care in New York if needed. So that's kind of the benefit there. Again, I think, Dennis mentioned there's some people who are down in Denver. Maybe at some point that becomes an opportunity to build what we call like a microsite. So an even smaller version of what we're already doing. And maybe it just operates 2 or 3 days a week to support that population. That could be beneficial in the future.
Okay, thank you. Council Maestri.
So the county had a similar program, didn't they, Marissa? And it
I don't
It
know if
failed?
the county had it. We had a clinic for a brief period of time. Gosh, when was it? A decade ago, decade or more ago. And that ended up not working, not because we didn't have employee interest in it, but because of the management model of the clinic, the provider. It did not work out with them. So that was one of the things that was very important to us as part of our due diligence this time, was really getting to know who this clinic was. And it really wasn't our clinic. It was shared with other employers.
Mhm.
So it was not.
Can you get us some background on the county clinic?
I can ask about that. Yeah, I don't
And
know.
then
They might
also-
have. I'm
And
not
then
sure.
also, because I know that the employees kind of panicked after they closed the services because it wasn't sustainable. And, because that's the one thing that's really hard to do lately too, is to get back in with the doctor's office, a care provider here. Once you give up your care provider, it's hard to get back in. So those are some would be concerns also. Marissa, if you could look into that, I'd appreciate it.
Sure.
Okay. Is that it? Any other councilors? Any other comments? Dennis, you good?
Thank you.
Thank you.
Thanks, everyone.
Thank you. Okay. Item agenda C is up next. Lessons learned from the Great Depression, Jerry Pacheco, Tactical Governance Group, 15-minute presentation. Okay, Mr. Pacheco, turn your mic on if you would.
Good evening. I'll try to be brief. I didn't prepare a full presentation for you this evening. I wanted to address some concerns that you're going to be dealing with shortly as you look at the 2026 budget. And I thought it would be a good opportunity to, some of you have already reached out to me and asked, okay, what did you do during the Great Recession from 2008 to 2012? And there's valuable lessons that we learned during that period of time. For example, percentage across the board cuts, things like that don't work. And one of the reasons why they don't work is you have minimum mandatory staffing in some departments, but not every department. You also have, when it comes to insurance, for example, in 2008, there was a lot of discussion about balancing the budget by reducing the benefits that are provided in the labor contracts. Well, the city council at the time weighed that issue, and it was decided that the community needed to take the least disruptive approach to balancing the 2008 budget. The situation in 2008 was severe because we were at the beginning of the Great Recession. We anticipated the 2007 fiscal year to end year over year over 2006 by like 3%, 3.5%. And the city manager in 2008 proposed a budget that had an additional 3 to 4% over what we anticipated we would receive in 2007. That didn't materialize. Once we got our audited financial statements back, we didn't end 2007 where we thought we were. So we were immediately in a deficit. Now, just about every single year you have a deficit. You start the year, you start the budget process with a deficit. You can go back the last 20 years and look at every single budget, and you have rolling in, you have a deficit number. It varies year over year. The flexibility that you have is in your undesignated fund balance for future appropriations number. That's usually the last number. That is the amount of money you have in the bank over and above your Tabor reserve, your 10% city council reserve. I assume it's still 10%. There's like an 8.33 cash flow reserve that used to show up in the budget. It doesn't show up now because I don't know why the finance department books it differently these days, but be that as it may, if there is going to be a significant deficit and you don't have the ability to balance it with your undesignated fund balance, okay, then you're looking at operational cuts. Then you're starting to talk about, okay, what things are we doing today that we have to stop doing? And it was very severe over that period of time. We had to replace the finance director, the airport director, the parks director, the public works director. Chief Billings retired, so we brought in Lou Velez for a short period of time. Tom Jagger retired, so we had to replace the law department. So there was a lot going on. I mean, a lot going on. And trying to downsize in the least disruptive way. The city council members were getting phone calls left and right about, are we going to have to reduce the workforce like we did in 1982? That's the last time that I can recall that the city had to go through budget cuts so severe that there was actually the reduction in force provisions in the labor contracts and everything had to come into effect. For example, at the time, Chief Billings was the chief of police, and so he was helping us on, getting a firm understanding of the police department. He and Deputy Chief Urkel at the time, they relayed the stories about the waterfall, that what happens in a union shop, the last in is the first out. Okay, so if you have to reduce your police department, it's your youngest, newest officers, which are typically your patrol individuals. Okay, so the police department is your largest cost center. Second is fire. Third is public works. Fourth is parks. At least it used to be that way. It's probably the same today. So those larger departments have minimum mandatory staffing. The other thing that's compounded in this broad discussion is when you talk about percent cuts across the boards, you have enterprise funds. Not all the enterprise funds utilize general fund dollars. For example, your wastewater department. Your wastewater department is funded entirely by fees. And the services that the city provides to that enterprise fund are paid for by that enterprise fund back into the city coffers. So it's not as cut and dry. It's having to methodically think about, okay, what do we absolutely have to do and start there? Because, there were some discussions that I heard about, okay, 15% across the board. That's not a very good approach. I just want to let you know that if it does come to pass that there is a significant budget crisis, that some public outreach, some discussions, you may want to consider a blue ribbon panel or some other citizen panel to help you work through this. You don't want to unnecessarily scare the public. When you're talking about reduction in force, people are losing their jobs. And those, in a lot of cases, those people are citizens that vote in the elections, and Pueblo is one of those communities where everybody's kind of related to everybody, or at least got a lot of relatives around. So I just thought I'd make myself available to answer any questions that you might have or some concerns. I got a lot of notes and a lot of things. I didn't know exactly what you all wanted to address, but I just wanted to let you know that my company is a resource, but there are other companies that do this similar work. Tactical Governance Group is a company that specializes in providing local governments unique solutions to challenging problems. For example, Trinidad is trying to get their urban renewal authority up and going, and they don't necessarily have the depth of resources, but they still need that expertise. They can't. So working in this space for about 30 years now, I've had the opportunity to see a lot of things, face a lot of serious problems. I don't think I'd ever want to be a city manager ever again. That's a very tough job. I was 33 years old when I took that job, and I didn't want the job. I agreed to do it for 90 days and then ended up, because of the strong mayor form of government thing was discussed in 2009, the city council asked me to become the permanent city manager, but I had never, ever did I have career aspirations to be a city manager. I was a city planning director, and that's what my master's degree is in, and that's what I do. Unfortunately, with my experience over the years, I had to learn everything about how the city of Pueblo government works. And there's kind of a pattern and theme. Once you understand the municipal code, they don't vary that much, really. In fact, when I was in graduate school, I worked 20 hours a week at one community and 25 hours a week at another community, and I had to know 2 separate sets of codes. So I'm kind of a weird geek when it comes to governance stuff. And so I think I can make the most impact in that consulting space. So I just wanted to provide this opportunity. If you have any questions going into budget, particularly if some of the things pass or don't pass, I don't think the public is going to approve an additional 1% tax because it's a regressive tax. Regressive taxes normally don't pass, particularly a full percent. That's a pretty significant move. So if that does not come to pass and you do have a budget crisis, then you've got a lot of work ahead of you before December 1st, when the budget is absolutely required to be filed with the state. So with that, I'd be happy to answer any questions. I know Commissioner Councilmember
Meisner,
Gomez.
please.
Hey, Mr. Pacheco. Something I've been thinking about when we talk about this recession and when I, also my industry was very affected by the recession and so forth. I could actually see it coming in 95 when I was doing mortgage loans and they took away all the guidelines, the conditions in order to apply. I could see like the failure, this is going to fail at some point. I mean, I was watching people use whiteout on documents and so forth to get those things done to meet those new requirements, So that when you see stuff like that, it's getting ready to fail. And so I've always thought that, because I noticed that the strong mayor form of government was fought from 2009 to 2018 till finally they put it on the ballot, and they said, oh, well, it's because the council city manager was failing, but the councilor city manager form went in over a decade of recession. There's nothing sexy about that time for anyone. So I think by the time, 2018 came along, they're like, oh, anything's better than what we've just been through. Well, we've been through a recession. That's not fun. That's not fun for anyone. And, I think too, when you look at the most influx of money in the past 25 years came through the strong mayor. We had this big influx of money, but then if we get to the end of this budget and all the reserves are gone and all that money was spent, and we have, assets with mortgages on them, and we have, did that work? Did that really work for Pueblo? I think that's the big question out there. There was a lot of money spent, and what I thought was really, in my experience, what I thought was really strange was this concerted effort or collaborative effort to really kind of rid ourselves of representative government. I watched that come through when we elected to go to a strong mayor form of government, and all the training that went on at that institute over in New York at the Harvard Institute with Bloomberg, and all of those teachings of all the department heads and all the investment. Well, we didn't really invest because Harvard was willing to do that for free. Bloomberg was willing to say, come here, let me teach you a different government from a world point of view and not necessarily from a strong republic constitutional, how we govern here in the United States. And so we get here to this day and we're at a crossroads. Pueblo is at a crossroads big time. And you have to be really involved. You have to really, we changed governance, but the people's mindset didn't change because there was never any sort of education to the public and even into leadership on how this really runs. And so there's always this crossover of each other's boundaries. But the bottom line, I remember here a couple of years ago when the former mayor's finance director, Alexandria Romero, said that if we kept this up on this spending, we would be out of reserves in 2027. She said that. It's a matter of record. If people watch the video. And guess what? Because everybody said, oh no, she doesn't know what she's talking about. Here we are today.
You know, the city competes for talent.
Mm-hmm.
Under the city manager system, it's incumbent upon the city manager to bring the city the best talent that they have because they're the individual that appoints those people.
Mm-hmm.
And in 2009, we had significant turnover because we needed expertise that we didn't have.
Mm-hmm.
Okay. And so like Sam Azad, for example, we brought Sam Azad to Pueblo. Sam Azad has a master's degree in econometrics. And back in those days, you basically had you had an assistant city manager for finance, and then you had the finance director. The finance director handled all the forecasting, the city's investments, and all of those things. The accounting function and the budgeting function was handled by another individual. So, you know, we tried to optimize the parks department. So we went out and got Creighton Wright from Queen Creek, Arizona. He was a bright up and coming individual, had a master's degree in parks and recreation management. And so we brought him in and he made some significant changes there too. So you're only as good as the talent that you have.
Right.
You know, and you know, we've lost a lot of really good people over the years. And we've lost a lot of good community leaders and a lot of that memory is lost with them. For example, I was very close with Ralph Williams. And the reason why I was close with Ralph Williams is because he was the risk manager of the city when I was city manager. And between Ralph and Tom Jagger and some other individuals, even Dave Galley, when I was the planning director underneath Dave, they gave a lot of really good advice and context of why the city does things a certain way. And to the casual observer, it's like, why does the city do that? You know, it doesn't make any sense. Well, if it's a long-standing tradition, there is a reason. But that reason is an oral tradition that's passed down by directors to mid-managers and managers to employees. And in the old system, you know, you going way back, you had to be a city resident in order to take the civil service exam. You know, so the city was very, very focused on getting the best talent and local talent and things like that. So things are different today.
Yeah.
But if you do not have the talent that you need to go out and either hire a consultant to do it, or you need to hire or have, you know, your staffing adjusted to provide and go out and get that talent. And that talent is not going to be cheap. Right now, for example, Canyon City, Florence, Palmer Lake, Raton, and some others are all hiring city managers right now. So the other thing is there's some budget problems in some other municipalities up the Front Range, Colorado Springs, Palmer Lake, some others. So as you said earlier, we're seeing some warning signs. And one of the things that you don't want to do is spend one-time money expanding services, and that's kind of what's been happening. So,
Well, yes, especially with, you know, the 1%, it's, we have a shortfall, you know, of, so far of record, it's been said 12.5 million. So there's part of your 26 million that you may anticipate on the 1%. Well, it grows every year with inflation, that budget. So that 1% is not going to mean anything by year 2. It's just going to hopefully not put us in a deficit, maybe. But how many improvements are we going to make? Because if we wanted to keep up with our roads, it's $10 million a year investment in road repair and maintenance in order to keep up with the 1,200 miles that we have that need to be repaired. So we've only done, I don't know what, 30, 45 miles, something like that. But, you know, and then again, the road repairs we did do is not because we took it from our coffers or our budget, but because we asked the citizens to give up their local Tabor tax, that one and done. So there's a lot of things, and that's, you know, city managers, that's what they go to school for. That's what they get their education. That's what they grow up to be. Hey, I'm going to grow up and be a city manager. And so they're educated, they're experienced, they have proven measures behind them. And it's really important. That's what's really important. I can't imagine in my world, in my career, my boss, you know, saying, oh, well, we're going to draw names out of a hat and see who's going to, you know, take your position. You know, that just doesn't happen in the real world. And sometimes you have to equate that to, you know, everything in life. You know, it's good to have that experience in place. Thank you for your time tonight. I appreciate you.
Counselor Joe Latino, please.
Yes, thank you. Mr. Pacheco, I want to first of all, thank you for all the work that you've helped us to get us done on the east side in District 2. Having taken down those blighted houses and having taken the time to reconstruct that area and put duplexes in that area has been unbelievable. And then we're getting started on 3rd and Hudson there with what you had going there. From the bottom of my heart, I thank you. And the people in our community, thank you. Secondly, if there's a $15 million deficit in the budget, what would you recommend, Jerry?
well, the first things first is you got to see how you ended last year. I'm not familiar with how you ended fiscal year 2024, because that's where you start, is there. How much money do you have in the bank? How much flexibility do you have? What is that number in your undesignated fund balance? That's a very important number. During those years, 2009, 10, 11, 12, that number was 0 in our recommended budget. It was that tight. And so we had to monitor it every month. And we held a lot of positions open. It was pretty tough, but some things that have happened over the last several years is you've expanded services significantly, but you haven't had the growth of new residents to help pay for that stuff. And it's further compounded by, we didn't have as many fires then that we do now. It's become a much, much bigger issue over the years. And if a house catches fire and you're deploying the fire department, that's a cost. There's an opportunity cost in that. And so when they keep having to go back to the same house, you're better off figuring out a way to pay for it and knock it down, because instead of just burning up all your employees. Also, it drags down the values in that particular neighborhood. So those are new problems. We didn't have those back then. So there's a lot to it. And a lot of that is getting you the information that you need. Okay? These department heads don't work for you. They work for the mayor. If there was a city manager, they would work for the city manager, but it's a different dynamic of a city manager and a mayor. The city council has the city manager, and the city manager is responsible for getting everybody to row in the right direction based on the policy direction from the council. It's different in the current system. But you still retain budgetary oversight. It is your responsibility to approve the budget. The administration, be it a city manager or a mayor, we just recommend the budget. You all are the ones who have the right to the information. You can convene hearings. You could do any investigative thing that you want to get the information that you need. But you got a small window. I haven't seen the recommended budget yet. In the old days, it would have been done by like October 1st. The audit would have been done back in May. I don't know what the audit says, haven't looked at it, but there's some ways to start that process and to get you all kind of focused and not have you argue about things or debate things that are impossibilities. For example, minimum mandatory staffing in certain areas. It is not worth the risk to disrupt some of those services. Those are critical services.
Okay. Good.
The charter has a provision for bureau chiefs. Can you explain what those are and how that can save revenues in these times?
Well, it speaks to span and control. The reason why the city has so many department heads is you got to think about this. This was in the 1950s when a lot of this stuff was approved, and you didn't have the technology, and you needed a physical manager accountable to the supervisor in these departments, accountable to the city manager. For example, you have a purchasing department of, it used to be like 3 people. And you've got like 20 some odd departments. What I would, if you could collapse some departments underneath what they call bureau chief. The last kind of real bureau chief we had was Dan Senta when he was over public works, wastewater, stormwater. But Dan Senta in the airport and transportation, but Dan was a unique individual. Very, very highly respected. He started his career as a draftsman in the early 70s, and he finished as public works director, bureau chief. So, you need to bring in some talent and some advice. If it's as bad as what people are saying it is, you're going to go back through that same situation that we had in 2008, and you're going to have to monitor it every month.
Thank you. Thank you very much.
Okay, Councilor Boston, you good? Sarah, are you available? Sarah Martinez?
Yeah, yep, I'm here. Can you hear me?
You're breaking up again, Sarah.
Can you hear me?
Just give it another shot.
Is that work?
No, it's still breaking up. I'm not sure where to go from here, but let's give it one more try. See if we can catch you. I
just have to say that I think that this topic is extraordinarily inappropriate, considering that we have 2 active ballot measures on this topic significantly. And I think that like a lot of this is campaigning, and
well, we're catching some of it, but not all of it.
Can you turn the video off?
Yeah, maybe let's try that. Turn the video off. Maybe just get her sound. Is that what you're saying? Let's try that. Sarah, you want to give it a shot?
is that better?
No, I don't think it got any better. Maybe I'll just jump into the question, see maybe they can fix this real quick. I got a question. The only thing I'm concerned about in reference to the assessment that you have as a professional for the last 30 years in this field, and your opinion matters to me. Under the current strong mayor form of government, and that's even going back to the last strong mayor form of government, what is your assessment of that type of government compared to a city manager?
All I would say is go look at the findings of the 2009 Blue Ribbon Panel on the Strong Mayor form of government.
What'd you call that?
There was a Blue Ribbon Panel convened by City Council in 2009 by community leaders.
Okay,
And that Blue Ribbon Panel investigated the issue and issued a report. And that report listed some concerns of things that could happen under a strong mayor system. I would just take that report, read it, and compare it to what the situation is today. That's all I would do.
okay,
I think your answer is there.
okay. Any other questions? Council, Mayor, you good? Everybody's good? Okay, I think we're good. I think we're concluded.
Well, thank you. If you guys have any questions, comments, concerns, let me know. Marissa and I have 5 children in this town. We wish they would stay here. Good luck.
Thank you, sir. Okay, let's move on to item agenda D, the Pedco contract. President Mark Aliff going to present.
Thank you. I have nothing to present. Obviously, I've had conversations with several counselors on city council, and there's two things that I want to bring up specifically. Without going into what was said at executive session or anything else like that, the fact is that on Tuesday of last week, the administration decided to cancel the contract of Pedco. So we haven't had much of a discussion about that. And you know, it was insinuated in the press release that city officials decided to do this, but not all city officials decided to do this. And it was also stated in the press release that this was conducive with city council's plan to do an RFI when it came to the through Pedco and the Chamber of Commerce. And if I remember that discussion we had amongst ourselves, that RFI was a transparency move to RFQ. It wasn't an RFQ when we decided that night. It was something else.
It was an RFQ. It's a request for qualifications.
Okay. Well, whatever it was to get in front of city council specific companies that could bring their services to Pueblo. What are their qualifications to ensure that we had the best representation? Pedco was obviously going to be involved with that. Chamber of Commerce is going to be involved with that. And so I just want to talk about any feelings that you guys may have on that subject. Councilor Flores. Well, I'm not in charge here.
That's fair. You're fine. Council Flores.
Yeah, this, this issue probably produces more questions to me than they do answers. And I wanted to ask our legal counsel some questions regarding the mayor making a unilateral decision on this and whether or not city council has the power to reinstate this contract. That's my first question.
I'm going to defer over to the city attorney, Carla Sykes. She's the one who's been working on Pedco, and she's a lot more familiar with the issues and the contract itself.
Okay.
Any questions I can answer, I will try my best, but I think Ms. Sykes is the best person for the job.
So I don't have the charter in front of me. I can't cite you the section, but the mayor has the ability to handle the contracts and to cancel the contracts. If there's any concerns about the contract, she's required to bring it forward to city council and advise them of those concerns, which she has done that. So she's followed that charter. If you give me a moment, I could probably pull up the section if you'd like me to.
Yeah, this is really an important question to me because there was not unanimity among the council as to our taking that action. And
well, and if I could say something else, the
Sure.
contract with Pedco is from 2008. There are some concerns with the contract just because of its age. And so when council decided to do an RFQ, the contract requires that there be 90 days notice before the contract can terminate. So 90 days notice was given to do that. And there's a wide variety of reasons which council is aware, but at a very minimal, the contract has to be redone. So consistent with the RFQ, going back out, inviting Pedco to reapply, contract needs to be redone. So that was one of the reasons that the decision was made to give the notice.
Did you might look this up too, and that is, did the 90 days have to be December 31? Could this decision have been made at a different time? It sounds like it doesn't quantify just because the contract is renewed every year that we necessarily take that 90 days at this time.
So there are a couple of different things in play here, and I won't speak to the mayor, so I'll let her chime in. But there's a couple different things in play. Contract renews at the end of every year. So it seemed to be an appropriate breaking point at this because it was going to renew at the end of the year. This is the same time of year that nonprofits like Pedco and all the rest have to apply for funds for next year. So there was an application process in place. A lot of those contracts had been reworked last year for the other nonprofits. So again, it seemed like it was a reasonable time to do it. And then you have the council action asking for RFQs and inviting Pedco to apply or to put in with those RFQs. So all of those things together, the timing of it seemed to be appropriate.
Can you take us back to that? The only thing I remember as far as the wording, but take us back to the beginning of September when this council passed an ordinance and it passed 5-2. I was one of the two that voted against it. But could you describe that ordinance, not having to do with this contract and with the termination, but with the
You mean the resolution for the RFQ?
for the resolution? What did it actually say? Did it pertain only to Pedco and no one else?
So no, the RFQ didn't pertain. It was only a resolution to direct staff or an invitation to have council do it themselves, to draft an RFQ, to go out and see what companies were out there that could provide this type of service and provide their qualifications and sort of a letter of interest sort of thing. So that's what it was. And Councilor Maestri had talked to Pedco, let them know that it was coming and that they would be encouraged to participate in that process. So that's what council did. That was my recollection of, again, I don't have it in front of me, but that's my recollection of it.
Yeah, and the major question here is whether or not council has the power to, number one, reinstate this or send it back for negotiations of maybe changing the contract. And well, you need more research to answer
So
that.
I can tell you the section of the charter, I can't pull it up on my phone, I'm sorry, is section 4-4G, which is the mayor's responsibilities and duties to enforce the terms of contracts. And so I think you all know there's a little bit more going on here than just the contract, but the timing of it seemed to be appropriate.
And I guess that's my issue, is that the timing was inappropriate to me. We're in the middle of negotiating with a major employer. And now, as I understand, as I keep talking to Jeff at Pedco, there are a lot of people now wondering what the hell is going on in Pueblo, Colorado, including this very, very large employer that we may potentially scare off. There are people in Denver that we have. And when I say we, the public needs to know that whatever the issue is with Pedco, we actually have 3 people that serve on that board. The mayor serves as an ex officio officer. I serve as a voting member, and Brett Boston votes as a. So this is very personal to me because this isn't just a typical contract. It's a contract that was terminated which I think looks bad for me. I've been serving on PEDCO for a number of years. What is it that that caused this? I don't think that an RFQ is warranted here. And it's not warranted because there is no other organization that evolved from the public here. If you go back 42 years, you had a lot of individuals that gave their all to try to salvage the unemployment rate, which was 20%, 20% back in the period that the steel industry just took a nosedive. So they all had a part in creating this model that we have called PEDCO. And I don't think people understand too that the city contributes somewhere between 30 to 35% of their budget, but the rest of the budget that PEDCO survives on is membership fees. And they have close to 250 businesses that do that. And I think the timing, now that I've had a chance to think about it, and I know that we've had some discussion, I don't ever recollect sanctioning that this be done, but I did know enough that I know that the mayor has unilateral power to do this. My question has to do with how does this council get us back on the right track? And the question is very simple. You know, do we have the right as a city council to ask that this contract be reinstated? And that is my major question tonight at this point. That's all I have.
Okay, Annie, Mayor, you want to respond?
Yeah, thanks. Councilor Flores, why we're here sharing our feelings tonight, as President Aliff says, if city council wants to waive your executive session conversations, I'd be happy to name all of the reasons why I decided to end the PEDCO contract. And so that would be up to the city council, but it's not just because of the RFQ. This contract needs to be rewritten, whether it's with PEDCO or whether it's another economic development firm that comes into our community. Our citizens want to know what our ROI is on the dollars that we're giving into economic development. The city of Pueblo provides $350,000 a year to PEDCO, specifically for marketing and advertising. That is what their contract says. If we are going to look at bringing in a new economic development partner, or if it's going to be PEDCO who reapplies for this contract will be very well written to where the city has the right to know where your dollars are being spent, what your return on investment is for this community and this half-cent sales tax. But if you want to waive your executive session, I've been more than happy to take a deep dive into this contract.
Not one way or executive.
Yeah, I didn't think you did.
But I don't want that. But I don't agree with everything that you did.
That's okay if you don't agree, but if you're gonna be putting it out on for the community to talk about your feelings, well, then let's talk about our feelings. And let's talk about the reasons why I ended this contract instead of just dancing around thinking that I just have the authority and that it wasn't well warranted, because I'd be happy to tell you exactly why it was warranted.
Well, I'm willing to have that discussion in executive session, but I'm not willing to dirty the laundry and also impeach. Okay, you're talking about impeachment of myself too, because I'm on that board, and the good work that they've done over the years. And if you want to put doubt in the public's mind right now by what you just said, go right ahead. But I have to know whether or not this council can change that decision. I know she has a right to cancel the contract. She's done it. I don't agree with what we discussed in private, and I won't say it publicly, but we have to have a real meaningful discussion and not threats, okay, that we have the ability as a city council to reinstate this contract.
So the council has, the contract has been canceled. I don't know about the ability to reinstate it. If council wants to direct or ask that a new contract be negotiated and entered into, I think the council has a right to pass contracts and approve contracts. So if that's what council wants to do, then council can ask to do that. But I think in that discussion, what I would ask everybody to do, and I know it's hard when council members sit on a board and then also on city council, but I do think that you need to take off the one hat and put on the city hat and look at what is the best interest of the city and not necessarily what's the best interest of PEDCO in this particular situation. And through that discussion, there's gonna be discussions at that point as to why and whether a contract is a good idea. So it's completely up to council. If council wants to ask that a new contract be negotiated, I am happy to sit down with PEDCO and attempt to do that. But my recommendation would be that it needs to be a new contract because the old contract obviously has some issues and it's already been canceled. The notice has been given. So you can enter into a new contract if that's what you want, and we can bring that before council by ordinance.
You mentioned that the old contract has issues. Does that mean that the old contract may have contributed to this confusion that we're having in this discussion?
I believe that the old contract on any issues that we have is clear, but that opinion is not shared by all.
Right.
Yeah.
Well, I'd like, I mean, we have, this is not a meeting. This is something that I can bring forward. I would like to talk about that possibility of entering into a new contract and bringing it back to city council.
Now, is that, as far as timing, is that something you want to do before the RFQ goes out and comes back? Because you may be negotiating a new contract with PEDCO and then have the RFQ come back with several other options. So again, I'm happy to do whatever you want. I'm just asking the question.
I am against, this is, the timing on this is so bad that I wouldn't have a problem of looking at an RFQ into the future. But this particular, this timing it couldn't be more horrible. And I'm against sending out an RFQ. And I want us to look at the possibility of putting a new contract in place with PEDCO so that we can answer some of these. I looked at the contract. I mean, and by the way, I'm looking at the mayor's letter here. She's asking for information regarding the Pueblo Development Foundation and the PEDCO Foundation. PEDCO doesn't have any responsibility for those two entities. They have their own boards, their own directors, and those are questions that should be asked directly to these entities. They have their own autonomy and their own boards. So asking PEDCO to go fund to provide information and get she wants to know what they own, whether there's contracts, leases, agreements, and other records. I don't think there's a full understanding of all the relationships that we have.
Well, as you know, PEDCO works hand in glove with PDF and with PEDCO Foundation. So those are things, and all the deals that we've negotiated through PEDCO, all of those companies worked together on those projects. So I don't think it's out of place to say that PEDCO would have information about that. But separate letters are going to go out to those entities.
It's clear here. Please provide the city with the list, all properties currently held by Pueblo Development Foundation and PEDCO Foundation. Those aren't questions you ask PEDCO.
I would think that PEDCO would be able to answer those questions because usually that information I get from PEDCO, but I understand what you're saying. And that is that separate letters need to go out to those entities. So they are separate entities. I agree. And so separate letters will go out to those entities.
That's what I mean by we need more clarity. We need a better contract with PEDCO. And I mean, that's my feelings. That's my feelings. You know, the rest of the council can take a different direction.
I'd like to just jump in here real quick. I sit on the Pueblo Development Foundation, and there's nothing far from the truth. They're completely separate. I don't know where you're getting information, but obviously you haven't done your homework again, and you're completely wrong about that. Council Maestri.
I did say that they were completely separate. I just said that Pedco works
They-
with them hand in glove.
They have not worked with them hand in glove.
Okay.
Council, President Mark Harleth, please.
I think it's important for us to understand that it may be best when the RFQs go out that we decide to go a different direction. That may happen. It may turn out that that's the way that everybody wants to go. My gripe is in the way that we did it. It would be different if the message to the community is this is a bad contract. It needs to be redone. We're also looking at putting out an RFQ. Bare minimum, the contract has to be done. And over the next several months, city council and the administration are going to be looking at all different opportunities moving forward when it comes to economic development. That's messaging that everybody can buy into. Instead, we don't have a plan. The only plan we have is that we have an RFQ that's going to go out. And in 90 days, on January 1st, the contract with Pedco will be null and void. And we will not have an economic development arm employed by the city of Pueblo come January 1st. And we all know how important that is to the community to have that happen. So why, that's all I'm confused about, and that's all I'm asking about is does it have to be in 90 days? How are we going to have a decision made in 90 days, how we're going to move forward with economic development? But we are not going to have a contracted economic developer come January 1st. It will be impossible, the way government works, for anything to be in place by the 1st of January moving forward. I doubt that we could probably get all of the, how long does the RFQs go out?
Well, it's my understanding that the RFQ is going to be forthcoming sometime soon.
Okay.
And then the RFQ would go out, that really is determined, it's usually between 21 and 30 days. So you'd have that back and then you could do requests for proposals after that. So realistically, you could have something in place by the end of the year. And I just want to remind you, the contract with Pedco has always been non-exclusive. So whether or not they have a contract, first of all, the contract goes to the end of the year. So I would hope that Pedco would continue doing what they're doing till the end of the year. And the city doesn't need a contract with Pedco for Pedco to do economic development. It's been doing economic development before the city. It'll continue doing it after the city if the city doesn't have a contract with it. So we don't need a contract with them for them to do economic development. And we can still maintain that partnership. The only thing it's going to do is the city does not have any contract to pay them any money to do economic development. And that, again, is free for council to negotiate, but they can continue to do economic development. There's nothing changed about that.
Thank you.
Councilor Flores, please. No. Council Maestri.
Well, we can't talk about what happened in executive session because it's really, it's unsubstantiated as far as the discussion. But what I can say is what wasn't discussed is it wasn't discussed that that this decision was being made based off the RFQ, like the press release had said. That was not a discussion as to why this was being done. And so the other thing too is that you're actually bringing unsubstantiated claims to us when you're wanting to discuss what's going on. Those are usually held through independent audits and investigations, third party. So
why you're
drawing a
you're
conclusion.
putting us in a really tough spot. Because you're putting things out there that we are not able to respond to because it was discussed in the executive session.
I'm talking
But
about process.
I know, but the process is that we can't know anything unless we have the information. And why don't we have the information?
Well, that's why you put a third and do an independent audit.
We don't have any authority
Because-
to do that.
because-
They are a private entity. We do not have any authority to require
The charter
or
says
send in an
under
audit to do
independent
that.
audits. It's
We
a
cannot
third
do an
party.
independent audit of a private company. That's part of the problem. We don't have any mechanism. It's not like urban renewal that is a quasi governmental entity. It's a little bit different.
And then do we need to cancel a contract? We can't amend a contract at the end of the term when we renew it. It has to be a complete cancellation.
So you can amend it. It was the mayor's choice in this case, based upon all of the information, that it was in the best interest of the city to cancel the contract. I tried to explain that. I just don't, we can only use the information that is before us. And if we don't have all the information, then we have to go off the information that's available.
So aren't you insinuating? Like based off of the information given to you, you're just alleging at that point, right? You don't have any, you're
I think you
making.
can make some assumptions from the information that we have. And all we can do is go off the information that we
This is
have.
law. This is law. You can't make assumptions and execute something based off of assumptions. This is all law, correct?
Okay, so we're not in a court of law. This was
Every
contract
that we do is
negotiation.
legal, right?
That is right. But there's two sides to everything. And so again, you're putting me and staff in a really tough position because we're not allowed to talk about what was talked about in the executive session, but you keep throwing stuff out that we can't respond to.
I'm just talking about process.
Okay, well, process typically, hypothetically, if we ask for information from someone we contract with, then we hope that we get back the information we've requested. When we don't get that information and they're the only ones that hold that information, there is no way for us to prove one way or the other that anything happened because we don't have the information. The only person who has control of that information is that third party. And we don't have any mechanism to force them to give us that information short of a lawsuit. In a lawsuit, then we would have the ability to force them to give that information. But short of that, we don't have any ability to do that. So we can only go on the information and draw certain conclusions from the information or the lack of information that was provided.
Are we treating all contractual agreements like that? Like you've treated this one?
So if another contractual obligation came to me under these same situations, same set of facts, yes, I would absolutely treat it the same.
Okay, Counselor Flores.
I just wanted to call a point of order here. We're getting too darn close, okay, to what we discussed in executive session. I'd like to take a poll to find out whether or not there's any interest in reinstating this contract and doing it correctly and potentially sending out an RFQ in the future and amending something that we're not rushed into that I feel happened here.
I'm in favor of that.
Okay. I'm in favor of it.
Counselor Boston?
No.
Counselor Ailer?
Yes, I would be.
I would as well. Counselor Maestri?
I guess we could take a look at what you're going to propose, because whether it's Pedco or whatever we decide to do here in the future, the language should read the same.
And most likely what we'll be proposing is our standard professional services contract, which I've already provided to you, Counselor Maestri, so you've seen it.
I'm sure that the exhibit is going to need to be updated.
Absolutely.
That's where the language comes in, is in the exhibit.
Yeah, so under the scope of services.
Can we all see that contract?
Sure.
You send it to us?
Sure, I can send it. I'll send the same thing I sent to Counselor Maestri to the rest of council.
I'd like to add something real quick, taking privilege here, but just to keep this in perspective, I did some research on my own as usual. But we've got the years 2015 to 2025, you guys brought us some numbers, and I just want to just go over this real quick for a minute or so. For instance, 2015 Vestas Manufacturing expanded jobs and went from an expansion of 120 jobs. 2015 expansion project 7, 80 jobs. 2015 small business startups that they helped startups to start up was 50. 2016 Walgreens distribution, 150 jobs. 2016 tech startup incubator, 100 jobs. Local manufacturing growth in 2016, expansion another 100 jobs. 2017 advanced manufacturing, 250 jobs. 2017 retail and services expansion, 100 jobs. 2017 construction for facility upgrades, and this was temporarily, so they put down 50, so we'll knock that out. Renewable energy component manufactured 2018, 200 jobs. Aerospace tech startup support, 150 jobs. 2018 construction infrastructure, 100 jobs. 2019 new companies in Pueblo Industrial Park, 250 job expansion. 2019 small business expansions, 150 jobs. 2019 temporary construction jobs, 100. 2020 business retention during COVID was 200 jobs they saved. Logistics company relocation 2021 expansion was 150 jobs. Clean energy projects expansion 100 jobs in 2021. 2021 again construction. This is temporary. This was to the building of the jobs was 100. 2022 aerospace manufacturing expansion 200 jobs. Advanced tech startups 150 jobs in 2022. 2022 construction 50 jobs, that was temporary, and 2023 manufacturing and high-tech expansions, 300 jobs. That comes out to 3,380 jobs. And excuse me, that's not a failure. Thank you.
Can I just ask one question? And I just want you guys to think about it. If this was any other contractor, wasn't Pedco, if this was any other contractor, would you guys be taking the same action based upon the information that you have?
You're
Or
entitled.
Or would you be going back to the contractor and asking them questions?
You're entitled to the contract when they have to have an annual report once a year. You want it every day or every quarter, whatever it is, but you're not entitled to it. I'm sorry, go ahead, Councilman Maestro.
We only asked for the information once this year.
You're not entitled to it, Councilman Maestro.
I realized that there were limitations in the contract as far as their obligations to report to us. And that was one of the reasons why I was bringing forward the RFQ. Sometimes a way to make a partner accountable or bring accountability is to put a little bit of competition in the room. So I thought that would be a good way before we completely sever the relationship or bring in bad blood, is to bring in a little bit of competition in the room. That's why Mr. Shaw said, fine, bring it on. But that's a way to bring accountability to a relationship without having to sever it. It's just good leadership. Working with partners. I know that, we had an attorney that lost his job specifically because it was bad leadership. But the same thing he was telling us that 2 years ago was the same thing that the attorney came here to train us about. He was telling us the same thing. And so it makes me wonder as to, we're picking and choosing at different times. We have really good relationships and then all of a sudden they go really bad. And what is that all about? What is the intention behind that? Because we're here to move Pueblo forward, rebuild, not necessarily tear down and destroy. And so that was the reason for the RFQ. And honestly, when I went and asked Mr. Gifford to do the RFQ, he said, oh, what a coincidence, because the mayor asked me to do an RFI for the same reason. An RFI is different than an RFQ. An RFI is already making a decision to terminate.
I'm sorry, I have to correct you. You asked for an RFI, I was the one who proposed that. What I stated was, I don't know what an RFI is.
Did you not tell me it was a coincidence that the mayor already asked for it?
I don't remember having that conversation. I may have said that, but I don't have any facts to support what you're claiming. And you were the one who asked for an RFI, and I was the one who wrote it up as an RFQ.
No, I
because have
asked
no idea
you,
what an
I
RFI
asked you what
is.
was the difference between an RFI and an RFQ. So I made sure that I had the correct the correct proposal, the correct,
Sure, and I
back
went, and I
written.
went,
So I asked you that.
I know.
Okay, that
Ma-
didn't
I-
say I
I
was
can-
defending. I was asking you for your legal
I can
opinion,
answer your
but
question.
you told
Let's not
me,
talk over each other.
but you told me that. And I also had, I went directly to President Aliff and told him what you had told me, that the mayor had asked for an RFI.
I can tell you that until you told me that you wanted me to draft an RFI, I had never heard the term RFI used. I Googled it. I still couldn't determine what an RFI was, so I assumed you wanted an RFQ. That is the truth of that.
We had one conversation, Mr. Gifford. I asked you what the difference was and I told RFQ. Okay? So you had told me what a coincidence because the mayor had already asked for one.
So Counselor Maestri, if I would submit, even based upon that, it seems like everybody, or at least you and the mayor, were thinking along the same lines as far as Pedco was concerned. Let's see what else we can find that's out there, right? Let's put out some feelers. So you guys were on the same page for that about the same time. All these other things came up along those lines, and it has always been my intention to not make this any kind of negative thing. There are things that we need to do. And I believe that the timing of it was advantageous for everybody. Those things can be corrected. So I don't think it has to be negative. Pedco, we can still work with Pedco. Pedco can still work with the companies that are coming in. Nothing of that has to change. The relationship can still be there. So I don't think it has to be negative. And I think it's going to depend on how everybody reacts to it and treats it is how it's going to be looked at.
I guess you should have started with the press release. Thank you.
I think we're getting pretty caught up on the weeds here. I think we're gonna move on. If anybody's any other things, any other comments, I think we're good. Thank you for your time. Thank you. And let's move on now to item agenda E, City Council Boards and Commissions update. Start with Sarah. Are you still there, Sarah? Sarah Martinez? Let's see if we can get your mic to work a little better. Let's give it, can you give it another shot? I don't think so.
He's passing.
Oh, she's passing. Okay. Council Flores, please.
I'm going to pass two tonight.
Council Maestri.
I'm going to pass on the regional because we were expecting to have a contract that we don't have one as of yet, to my knowledge. So I'm gonna just pass on tonight's.
Council Ayla.
Thank you, Chair. The HARP, the Riverwalk is doing fantastic. I don't know if anybody's looking over there, but that boathouse looks awesome. A lot of glass,
It's going to be a
can't
beautiful.
wait for it to open. As far as I know, it's still on track for November. Our meeting is Wednesday, so I'll be able to give you a better update. It'll probably be open and you guys will all be up there partying by the time I get to give another update. Fountain Creek Watershed District, nothing new. They're still working hard. Our homeless commission met for the first time last Friday. Was a great meeting. Everybody showed up except for one person who had prior commitments. It was a very vigorous meeting with some good back and forth and getting our feet wet. And we're looking forward to moving that on and coming back to City Council with some tangible and good ideas here in the near future. Our community development committee's working real hard. We're literally looking at something at our next meeting that I'm going to bring up about a development master plan. This hasn't been done in the city, and I don't know how many cities do it, but where you actually look, you take all of your areas where you can build, where it's already been zoned and plotted and so on and so forth. And we literally look as a city on what we can do as far as infrastructure and things like that to enhance those developments moving forward, or at least make the properties attractive to developers. So it's just an idea. I mean, we're just throwing it out there. But just to let you know that we're always looking, always thinking about trying different things. But that's a great group. The Community Development Committee that meets once a month. And with that being said, that's all I have.
Counselor Boss?
Thank you, Chair. Since the last time we did this, Pura and Pedco have not met. But PayCog, we had our audit done. It passed. Everything was clean. Another big update is I-25 Highway 50B intersection. I believe it's starting October 10th. The on-ramps, both north and south, are going to be closed until the completion of this entire project. So you're going to have to look for detours starting on October 10th for that exit. Planning and zoning, a new master sign plan was passed for the Pueblo Springs Apartments on Pueblo Boulevard, just to allow 2 signs. And there was a text amendment for that basically allowed for billboards to be put in a couple more zoning areas, and it allows for public-private partnerships for those new high-tech visual billboards that you see. So that should be exciting, and hopefully we can start taking advantage of those. And the Hart Foundation meeting is actually at the end of this month, so just boathouse. That's all I have tonight.
Council Latino?
I don't have any update. We were supposed to have an airport board meeting and that was canceled, postponed. We have some things going on there that we need to get resolved as it relates to the chairmanship. And at this point in time, I'm going to leave it at that.
Yeah, a couple of things I want to talk about real quick in reference to BAN, the Bessemer Association for Neighborhood Development. We have our first security patrol program review going on Wednesday at 3 o'clock at the NeighborWorks. And this is going to be also in reference to the Bessemer security plan for the park. It's going to all be on pilot basis. We're going to work to get funding to see if we can get out and get some visible support out to the community so they can have a little faith and believe that we're getting something done. So I'm working on that. Probably 1 to 3 months is what we're going to look for. And then I'm also going to work very closely with Joe. Joe's very interested in a band kind of project in the east side, because those, I guess, are 2 areas, again, as you know, about the prevalence of the crime, the poverty, and the homeless, all that good stuff. We got a majority of it. But Joe's group is going to be called EDGE, kind of like him, edgy, but it's going to be the East Side Development and Guardian Enforcement. And it's going to be an organization sort of like BAND is, sort of on the East Side. So we have a lot of people that want to support the low income areas, and they want to know, how do you write a check? So one of the things we said, well, what? You can't just write a check to East Side. You can't write a check to Bessemer. You have to go to a formal organization that's set up correctly. Now, I got a little program development experience because I developed a COVID program that's going for 35 years, so I must have done something right. But we're going to develop these programs, and we're going to get the funding for it, hopefully with everybody's support down the road. Because if we get the lower income areas, we work our way up. There's problems in the District 3, there's problems in District 1. There's all kinds of different areas that we can also expand out to. But that's kind of my update, and I will get back to you. And we are officially adjourned.
Thank you, Roger, for your help. Thank you.